I myself am a doctor, standard Western medicine. I have worked in Beijing Anzhen Hospital for 22 years, China's best cardiology hospital along with Fuwai Heart Hospital. Both of us are the best. We both do 30,000 surgeries a year. There is no third place. The third place do more than 10,000 cases. Can't compete with us. I learned the boundaries of medicine here. Okay? I tell you my story, real-life version. In Anzhen Hospital, our specialist outpatient clinic generally sees 30 patients in the morning. Of the 30 patients, only 5 patients should have surgery. Let's do the math. 30 minus 5, and there are 25. What should we do? 12 of these 25 should be prevented. Others are given coronary artery stenosis for more than 75% blockage. 50% of the patients are hospitalized. 50% should be prevented. What should I do? 50% should be prevented. We should tell them, why don't they achieve less than 75% constriction? So what do we say at the best Anzhen Hospital and the best Fuwai Hospital in China? Just 2 words, follow-up visits, and I will explain it to you. That is, to do CT every year. 50%, 60%, 70%. If 75% constriction, then surgery is required. Look for us. We will operate, and you just need to pay us for it. Even if you are not a doctor, you should know how to tell the patient not to reach 75%. Reduce it to 40%, though it is impossible to get it to 0. If patient is already 82 years old and still under 75%, then we have succeeded. It doesn't matter anymore. We don't need to maintain for traveling or work anymore. The average life expectancy is 82 to 84 years old in China. 25 minus 12. They're 13 that cause us to question our self-worth. Those are the ones that we do bypass and stents and yet doesn't improve. There is a 30% to 50% chance of reoccurrence. A waste of 3 years of effort. So we asked Dr. Liu, did you not build a good bridge for him? Or because he did not recover after surgery? Or was it anastomosis was narrow elsewhere? Who is to say? I couldn't say clearly. I usually do 4 to 6 surgeries a day, from 8 o'clock in the morning to 1 o'clock in the morning. When I come down, my mobile phone will be automatically turned off, and there will be more than 100 missed calls. All from patients who came to ask Dr. Liu how to eat, drink, and exercise, which is called postoperative rehabilitation. No, we Anzhen Hospital, we provide to only 300 out of 30,000 surgeries a year rehabilitation. They are rich people. 500,000 yuan a year, 500,000 yuan rehabilitation. And the remaining 29,700? Go where you want, I don't know you. This is the current situation, the boundaries of medicine in China. In the middle of the treatment cycle, there is no prevention. At the core of the treatment, the preventive measures are not given. The post-ops recovery options are not given. The complete flow of treatment should be prevention, dietary care, diagnosis, treatment, rehabilitation. Total of 5 stages in the chain. For us, we only did 2 of it. Diagnosis and treatment. Diagnose and then offer heart operation. No prevention advise, no post-ops advise. Whoever require operation gets admitted. If we are only doing these 2, we are surgeons, not doctors. Not worthy of the name. How do we treat then? In China, there are still doctors that are staunchly saying you have a heart condition, you should go on low-salt, low-fat diet. Whenever I hear that, I would say, it's time for you to retire. You're still living 20 years in the past. In the United States, 3,000 people die yearly before it was proven that low-salt food diet increases risk of heart failure by 4.8 times. So it is crucial we talk about integrating post-ops recovery. Professor who tells his patients, control your mouth, open your legs for recovery. Our patients listened and went home to walk 20,000 steps daily. I unfortunately am here to tell you, if they do not reach the exercise heart rate, the only effect of 20,000 steps is knee injury. There's no cardiac rehabilitation effect, only 90 to 110 heart rate. Hypothetical that this person's exercise heart rate, rehabilitation heart rate is 90 to 110. It only works when it reaches 90, and if it is more than 110, you should stop the exercise. Your muscles will be very toned, but at 110 heart rate, it enters the anaerobic exercise region, and a large amount of lactic acid is released that may cause serious damage to your cardiovascular and cerebrovascular vessels. So rehabilitation, it's not just understanding those 6 words that professor who said. The level of our Anzhen Hospital is not as good as that of professor who. We say 8 words, low salt, low fat. sufficient oxygen during exercise. Then you can go home. Do you understand it? You don't, not at all. This is called rehabilitation medicine. The 5 links of the complete chain are prevention, dietary health care, diagnosis, treatment, rehabilitation. This is the real boundaries of medicine.